Good afternoon, everyone. I'm just keeping watch on the attendees list and it's slowly increasing. Welcome to our webinar this afternoon. I'd like to just take about a minute or two just to wait for everyone else to join us and then we'll begin the webinar. Thank you. Okay, I think my 2 minutes is up. We can start and the rest of the attendees will join us. I'd like to take this time and welcome everyone to this webinar entitled The Impact of COVID-19, Awareness on Body Donation at UKZN. I've seen that we've got colleagues from our Anatomical Society of Southern Africa joining us. Welcome to you. Welcome to those coming from the university community at the University of KwaZulu-Natal, to colleagues, to postgrads that may be joining us. Welcome to our webinar. We're going to have, I'd just like to say at the beginning that we've got a slight change in our program. I'm going to be the facilitator. My name is Brenda Digama, currently senior lecturer at the University of KwaZulu-Natal in the discipline of clinical anatomy in the School of Laboratory Medicine and Medical Sciences. I also am an academic leader of research in the school as well, which is a fractional position. Joining me on this webinar, I have Dr. Pamela Pillay, I've got Ms. Sinead Singh, I've also got Mr. Celo Musambukazi. Unfortunately, Mr. Kaili Tlekwambe couldn't join us as per planned in our program, so that session is going to be covered by Mr. Celo Musambukazi. And the last thing I'm going to say before we move on and start with the program is that please use the Q&A function for any questions that you may have as we present. And also you can use the chat function. I've got people who are assisting me to keep an eye on that. And if you'd like to then at the end during the question and answer session, which we're going to have in the last 20 minutes of this webinar, and you'd like to have a live question, then please would you raise your hand at that time and then we'll give you the opportunity to ask your question. Thank you. I'd like to start off. I don't want to do a lot of introductory remarks as a facilitator because I'm doing the introductory presentation as well. So I'd like to head straight to it because if anyone is thinking, what is this all about? Then you're going to get answers through my presentation and also through my colleagues' presentations. I'm sharing my screen now. Can I have somebody confirm if it's now visible? It is. Thank you, Mr. Mbokazi. Okay, so really my introductory part is to really look at body donation. What is it about? And I like starting off with this comic. And just to ask, and I know with my ASA colleagues, they would definitely know the answer to this one. From your general knowledge, is this body donation? We've got a living person, which is Mr. Welch, and he's coming to donate his body. And definitely, I would say that is not a body donation. Because body donation is a donation that is bodies that we receive after death at the higher education institutes. So what is body donation? That's what we want to find out. It is defined by our other colleagues in the world, Ajita Singh and Rokat Bahiti, as an informed and free act of giving one's whole body after death, and emphasis on that, after death. So Mr. Welsh, who was still living, couldn't count as a donated body for medical education and research. Park et al. Uses this definition as one passes away, the family members bequeath one's body for medical education and research purposes with no compensation for doing so. And that is what we defined as a body bequest or body bequeathal. You find that when you look at literature, there's use of the terms anatomical donation, cadaver donation, whole body donation, and whole body donation has been used a lot as well recently. What I'd like to emphasize is that it is not organ donation. We find that the more we do research in this area, we find that there's a close misunderstanding between body donation and organ donation. If I were to use our vernacular language, it's not akukona ukunikelwa kwelunga lomzimba. It's ukunikelwa komzimba wonke umuntu meseshonile. I just wanted to use it the vernacular because we are UKZN and we are bilingual. So it's not organ donation, it's not a donation of an organ, it is donation of a whole body after death. To move on, so who is suitable to donate their bodies to science? Not all bodies are accepted. For instance, autopsied bodies, decomposed bodies. And I think one that would catch everyone's eye is death from contagious and communicable diseases, especially in the time of COVID-19. Suicide and homicide as well, we don't accept. And anything not in this criteria would then be regarded as suitable. However, I must state that each higher education institute as well is able to state what is suitable for them in their context as well for the TDs. Why is body donation important, especially for us who are anatomists? It comes as a learning tool. So it's very important as a learning tool. We teach future health science students and those who will be future health professionals. So we use it as a learning tool for anatomical and medical education. We can use it as well to determine between and differentiate between normal and anomalies, what you'd call abnormal morphology of structures, and also it can be used for surgical training. It has also been used previously, if I just have my pointer on, which is red, if you look at this picture here on plastination, which is a process where the fleshly tissue is converted by the use of a specific polymer to make it have a plastic appearance. These have been quite preferred lately as an additional tool to cadavers because they are odorless. So there's a big debate as far as that. Should we still have cadavers? Should we not? And each one, we have different views on that. I believe that we still need the cadavers and we can have all the other things as supplementary tools. It's also very important for professional development as well, especially in the dissecting hall when students work as teams, they interface with death. Ms. Singh is going to elaborate on this. And we also use it, most importantly, for research. And all the research that we use, which is very relevant for health diagnosis, health diseases, also in the medical sciences field as well, it's very important. And hence, we need bodies that are donated for research. I'll try to increase my pace so that I don't eat up too much of my time. It's also used for training of medical personnel, of course, like how we use it to train future medical doctors, practicing of surgical skills and developing new ones, venipuncture as well, previously it's been used for, and the mental structure of the future physician. Just likely for someone who wouldn't know what the process is towards if you want to be a body donor, the first important thing is find out information about body donation. And the best way to do that is to go to your nearest higher education institution or university that you know teaches human anatomy or is involved in the training of medical students and future health professionals, so that you make an informed decision. It's very important. Once you have the information, then you can make your decision. But before you fully make your decision, I normally encourage that you talk to family, you talk to friends, you talk to relatives. Family not agreeing with someone donating their bodies has come up as well in literature, as far as when people would say family not agreeing with donating becomes one of the factors that impact negatively on someone donating their body. So that would be what I'd highlight as a third step. And then once everyone is agreeable, then you fill the relevant forms, which you'll find at the nearest institution, depending in which province you are. For us, it's UKZN. And then you would then submit those forms to that institution as well. We have coordinators that are involved in our body donation programs, even in the other provinces and other universities as well. The question is, and I'm aware there's an article that actually uses this as a title, to donate or not to donate. I like it put like this because that's a decision that one normally has to make if they're interested about being a body donor. And there are various factors that impact on one actually deciding they'll donate or not donate. They vary from personal, and then they can be religious and cultural. And from the work that I've done personally, I've seen in KZN that the cultural reasons have come out strong in the predominantly Zulu ethnic group. I've had students like Ms. Sinead Singh, who's founded a predominantly religious community. And we've also had Ms. Cassandra Clark, who has also done it in a colored population and found religion as a factor as well. Then it could be economical, attitudinal, educational, and also psychological. So these are various factors that do impact on one's decision to donate or not. What are the reasons that people really do donate as literature? And there's also recent literature that speaks to this. It is regarded as an altruistic act, and really people want to donate because of that reason, and they have a desire to give back to the medical profession. It could be they were assisted medically, and they want to show their gratitude to the medical profession as well, and also as a desire to assist in training and education of future healthcare professionals as well, and to be useful after death. What are some of the reasons that people do not donate? Objections from family, you see them coming up. Body weight, indecision. Hence, it's very important that the person who's considering it is informed. It's very important. And also treatment during dissection, which is an important one for us as anatomists, because we teach these things to our students. We also ensure that we treat the donors that we receive, that we use as cadavers in the labs, with utmost respect as required from us. And also lack of knowledge, which is an interesting one because we can do something about that one. So really, what are suggested solutions to increase public understanding and of appropriateness and importance of BD, which is one of the objectives of this webinar. Raising awareness by all means to all people. There's a reason why we're having this webinar as well. And correctly structured body donation campaigns, which we have at UKZN, which Mr. Mbogazi is going to allude to. Solid body donor programs, supportive legislature, which we have in South Africa. Thankfully, we still have countries that are still on their journey to ensuring that they have this, and have buy-in from relevant stakeholders. And when I say stakeholders, really there are many: religious organizations, traditional leadership, individuals themselves from the public in all their different population groups. So relevant stakeholders, them buying into body donation is important. I don't want to go into too much detail with the next slides, but I just wanted to show you the picture as far as globally how it looks as far as body donation in the context. We have variation from exclusive use of body donation to exclusive use of unclaimed bodies, which is something that as anatomists we're not so happy about, and we're hoping and definitely will change in the near future. And then in the African context, we see that we have a variation from lack of information to exclusive use of unclaimed bodies. And I also believe, because there's not much of literature onto this, you will see here in the African continent where there's no information available, it means we still need to gather how they source their cadavers for medical and anatomical training. And then in South Africa, it is a relief that we all mostly use body donation, and as per IFAA and also our Society for Anatomical Society, we encourage sourcing cadavers through body donation, and we've strongly worked hard to move away from unclaimed bodies in South Africa. Has it always been like this? No, not really. And we see this as a snippet from the University of Witwatersrand and from literature that we had a movement really from predominantly being unclaimed, as you can see shown in red, and we've moved to increase of bequest bodies as well up until 2013. And you can also see here that unclaimed are predominantly from the Black African population group or population affinity. And you can see how that occurred in the previous years and how it has then declined. And you see where you have now a different increase, having white males and white females increasing, and these are bequests. Right, and again, we see that how the transition has happened, and this was a follow-up on the previous 2015 article by Kramer et al., and how the shift has now occurred where we have bequests and also donated bodies, and from which population group they have come from. Even here, you can see, according to 2017 data. And if we look at UKZN, lastly, I'm about to finish. We have predominantly male body donors, predominant age being 60 to 69 years old, and predominant donated bodies being from the white population affinity, which you see speaking the same language as what's occurring in the University of Witwatersrand. And not only, again, in the South African context, you see that being predominant as well as the characteristics that exist globally as well. This was work done by Adana and others at UKZN. And then as I go towards the end, predominant source now is from body donors, and it's through family bequests as well, which again, you will notice then, and you can see in this graph here, 75% of the bodies received from family bequests, which also we're seeing similarities as well with the University of Witwatersrand. Yes, that's it from my side and my presentation. Thank you so much. I hope that gave you a nice introduction, and you have sight of what's been going on globally in the African continent and here in South Africa. Next is a colleague of mine whom we work very well together, is Dr. Pamela Pillay, and I'd like to introduce her quickly. Dr. Pillay is an early career academic in the discipline of clinical anatomy. She is also the academic leader teaching and learning in the School of Laboratory Medicine and Medical Sciences in the College of Health Sciences at UKZN. She serves as a council member of the Anatomical Society of Southern Africa and as a UKZN Biomedical Research Ethics Committee member. Her research niche focuses on ethical frameworks that will guide research involving human remains, that is cadavers, skeletal remains, and fetal material, anatomical variations, and also anatomical or medical education. Her title for today is Best Practice Guidelines Before and During COVID-19 and Recommendations Going Forward. Dr. Pillay, you can share your screen and begin your presentation. Thank you.
Just having a bit of a network issue here. My bandwidth is a little bit low, so I'm just going to switch off my video during the presentation, so please don't consider it any way rude.
Noted, Dr. Pillay. Thank you.
Okay. Good afternoon, colleagues, ASA members, friends, students. Welcome to our webinar on body donation. I will highlight a few best practice guidelines before and during COVID-19, as well as give you some recommendations going forward. Now, body donation, as echoed by my colleague earlier, is an important resource for higher education institutions. South Africa is at a coal face experiencing critical shortages of human tissue, and this has impacted on anatomical teaching and research, as most of you would have experienced. Some of the ethical considerations related to the use of donated bodies are informed consent, human dignity, voluntary decision making, as well as human rights. Now, in order for us to maintain high ethical standards, it is imperative that we align to recommendations set out by anatomists internationally and nationally. UKZN aligns to the International Federation of Association of Anatomists recommendations. Informed consent, that means informed written consent, is an essential prerequisite for potential donors. According to the National Health Act of 2003, informed consent from donors must be obtained in writing before any donation can be accepted. Now, this means donors must be entirely free in their decision to donate. Now, in order for UKZN and donors to be legally protected, we have a very simple and transparent process that includes the donor filling out the purpose for donation, that is it for teaching, research, or both? When and if cremated remains should be returned to the donor, as well as informing them of the time frame for the use of the cadaver. Now, usually at university, bodies or body parts may be retained for them to be plastinated or used as prosected specimens for education or research. Now, this can only be done if the donor is informed of such practice and is agreed upon in writing. Now, these specimens that we retain may not be commercialized in any way. So one of the key areas we were working on at UKZN is the establishment of guidelines regulating the transport of human bodies or body parts within and between provinces. This arose as a subsequence of us acquiring cadaveric material from other provinces when we had a critical shortage. Now, we limit the extent to which images from donations are placed in the public domain. And this includes social media and online learning platforms. And during COVID, this presented a dilemma for academic staff within the discipline because we did not have consent from the body donors to release images on an online platform. We also follow a very clear and rigorous framework detailing the body donation process. Now, this will be picked up later on by one of our colleagues in the webinar. We also have institutional procedures that are formally established by an oversight committee. Now, this comprises an academic coordinator, myself, together with two senior technicians, Mr. Silimusa Mbukazi, as well as Mr. Kailisha Guambe. Now, the body donation program is reviewed at regular intervals in order for us to keep up to date and keep relevant with our practices. Additionally, in order to groom ethical thinking, our first year medical science students attend a course in anatomical ethics and law. Now, this module, it's aligned to educating students on the use of human remains for teaching and learning. In the lecture content, various aspects, including legal, ethical, and cultural issues are touched on. We end our academic year with a commemoration ceremony for those who have donated their bodies for teaching and learning. Now, lockdown due to COVID-19 began in South Africa in March 2020. Now, this was a conundrum for academic staff in anatomy. We had to move onto this virtual academic platform. At this time, the anatomists in the department had many concerns on the impact of COVID-19 on the body donation program. And this concern still continues and to grow exponentially. We had limited contact between staff and potential donors in 2020, and we had to use the online or a virtual method to contact our potential donors. And this was not the ideal or optimal way to do it because we were dealing with the aged. So although we were aware of the risk factors of COVID infections from the infected donor, it was not known at the time if this occurred. But other factors that needed to be considered were the incubation period, as well as the viability of the virus within the blood and specific organs. The safety and well-being of our staff was at the forefront of our concerns, and they were provided with sufficient protective gear during this period. Our technicians were also aware of the risk of transmission with invasive handling of the cadaver. There was regular deep cleaning and sanitization of our department and the dissection hall, and this took a lot of time and effort from support staff. Bodies were isolated when they were received, irrespective of whether they had a COVID positive status or not. Now, ethical consideration has been given to cadaver procurement at UKZN. We have moved from the use of the unclaimed body to the use of donated bodies. And anatomists in the department believe that the use of unclaimed bodies is unethical. It disregards dignity and human rights. Thus, we have aligned our body donation protocol to incorporate changes as well as take into account legislation and regulations. This is done in order to ensure that we maintain high ethical standards. Although the body donor numbers were slowly increasing, we still have a critical shortage for a sustainable dissection program. We are trying to bridge the gap of cultural limitation by establishing a relationship and educating communities on the value of body donation. However, during the COVID period, this had been difficult. Since 2016, we had received approximately 28 bodies per year for teaching and learning. By having these drives, we're trying to encourage family attendance as well, as the key goal is to ensure that family has an opportunity to make informed decisions. We also acknowledge the donors and we respect their altruistic gift to anatomy education. So, some of our recommendations for going forward. So, we will be following the infection prevention guidelines related to COVID, and we're also going to be aware of the evolving COVID guidelines. We will be able to screen and test cadavers as we receive them in the anatomy department. Additionally, we continue to separate donated bodies. Donors will also be made aware of alternative funeral plans just in case their body cannot be accepted into the department. We continue our ethical decision-making practices. We improve student and public engagement on body donation as we are doing today. We also will be exploring the medical, religious, and cultural aspects that hinder body donation success as our postgraduate students are currently embarking on that journey. Our body donation campaigns, although we cannot visit old age homes or hospitals anymore, we will be taking this virtually. We will target social media, YouTube, and use our webinars. So, in conclusion, in order for us to sustain a successful body donation program, which there would be an ethical, legal, and institutional governance that will allow us for a relationship between donors and their communities. Thank you for your attention.
Thank you so much, Dr. Pillay, for your presentation. I'd like to now move on to Ms. Sinead Singh. She's currently enrolled as a PhD student, majoring in medical science anatomy, intending to pursue a career in academia. She completed her MMed degree in 2020 due to graduate in our autumn graduation with the dissertation topic being awareness, perceptions, and religious attitudes towards whole body donation among an Indian community in eThekwini. She is passionate about the field of anatomy and specifically eager about ethical research in this field and its advancement through the procurement of cadavers for teaching in this discipline. Ms. Singh is going to have a presentation now titled, Why is it important? The Student Perspective. Ms. Sinead, over to you. You can share your screen. Thank you.
Okay, good afternoon to all those of you who voluntarily took the time to join in this panel discussion webinar on the impact of COVID-19 and awareness of body donation at UKZN. And I sincerely hope that all information that we discussed today will be beneficial to you and would help you gain more insight into this topic. So just going to share my screen. Okay, so I am going to touch on 3 key points related to the importance of body donation. That being firstly, the general importance of body donation, as well as the importance to the teaching of medical science students. My second point is my experience as a student and demonstrator in the Department of Human Anatomy at UKZN. And lastly, the effect that COVID-19 has had on students. So why is body donation important generally? We know that the human body is marvelous, and yes, it can be mysterious. We may not learn everything that we need to know about our bodies or how to treat every ailment that plagues us, but by advancing medical science and through the selfless generosity of donors, our knowledge does grow. The study of anatomy has been the foundation of the training of medical and allied health science students for hundreds of years. We have dentists, occupational therapists, physiotherapists, pharmacists, doctors, nurses, and medical scientists who all need to understand the structure of the human body so they have the necessary skills to do their jobs properly. Today, both aspiring and established doctors depend on the selflessness of donors to fine-tune their craft, to for new technique, new treatments and surgical approaches, as well as testing medical devices. Each donor, we can say, brings that project one step closer to the goal that is trying to be obtained. So, although experimenting on cadavers may sound gruesome, it is a long standing practice and it has the ability to advance medicine by leaps and bounds. And it has come a long way from the 1800s, where ambitious medical students, as well as teachers, actually robbed graves for the opportunity to practice dissection. So we should be so fortunate that we have body donor programs in place where we can experience this firsthand. Whole body donations are also used by practicing surgeons for surgical training and technique development, such as exploring better ways to perform procedures like transplants, joint replacements, etc. So, having access to the cadavers gives them the experience that's necessary to learn how to implant a device in a patient's spine, heart, or brain. And I'm sure you would prefer having a surgeon who has practiced a procedure on a cadaver first before performing it on you for the first time. Researchers also use the human body to see how diseases impact the body and to search for causes, which ultimately leads to the pursuit for cures. Forensic investigators use human bodies to help them identify time of death and by studying the decay that occurs to a body over a length of time and to help them learn how a person died. Now moving on more importantly to how is body donation important in the teaching of medical science students and medical students. So in other words, how does it benefit them and what knowledge does it provide them with? So educational institutions use cadavers to help explain anatomy and physiology to medical and medical science students. So this gives the students more insight into the need to understand human anatomy. Body donation also plays a critical role in helping the students to master the comprehension of the complex anatomy of the human body. And medical students use human bodies to learn and perfect the skills that will one day benefit the health of society. So within the department, dissection plays an important role in introducing the students to death because this actually provides the students with moral and ethical training so that they can have a humanistic approach to patient care in the future. It also provides students with a first-hand experience of anatomical structures. And so overall, the cadaver-based teaching prepares students intellectually and emotionally to deal with the challenges that they may face in their future careers in the medical field. Moving on to my experience as a student and a demonstrator in the Department of Human Anatomy at UKZN. So being a student in the anatomy department for the past 6 years, as well as being a demonstrator to undergraduate students in the dissecting hall for the past 3 years, there are a few things that I have noticed firsthand as a result of the scarcity of cadavers and the lack of body donors. So the main aspect that I have noticed is the student to cadaver ratio in the dissecting hall. And on average, this is prior to COVID, the ratio was approximately 10:1. And this is only due to the lack of body donors and the scarcity of cadavers that we may face. This high ratio of student to cadavers makes both teaching and learning a difficult task. So from a learning and a student point of view, it is challenging to acquire a deeper knowledge of anatomical structures through dissection in large groups, because not every student may get an opportunity to dissect and identify all the structures that need to be studied due to the shortage of cadavers and the high student cadaver ratio. And from a teaching point of view, being a demonstrator, I have noticed that this shortage of cadavers resulting in a high student to cadaver ratio sometimes tends to cause students to become lazy or withdraw themselves from dissection, as they feel they can take a step back and they will not be noticed in the large crowd by their superiors. And then they often tend to leave the same students to performing dissections while they take a step back. So I believe that if we had more body donors and people who are willing to donate their bodies, as well as family bequests, we would be able to acquire more cadavers for dissection, and it would reduce the student to cadaver ratio, and in so doing, alleviate these problems and make the teaching and learning aspect much more easier. Lastly, moving on to the effect that COVID-19 has had on students. So the COVID-19 pandemic, as we all know, has led to this mainly online-based mode of teaching. And this poses several challenges to medical science students. This means that the hands-on experience that students usually have becomes minimized, because without dissection of cadavers, teaching and learning of anatomy is nearly difficult, because there will always be that gap between the practical knowledge and the gathered theoretical knowledge. As much as you can study the theory component and learn the practical aspect through diagrams and cadaveric images, it definitely is not the same as the first-hand experience and knowledge that we gain through dissection. Also, during the outbreaks of infectious diseases like this, the sourcing of bodies and the continuance of donor programs comes under severe stress. So COVID-19 has certainly had an impact on the way in which students learn, the knowledge that is gained, as well as, most importantly, the acquisition of cadavers. I do hope that this information I shared helped you gain more insight into this topic from a student and a demonstrator point of view. Thank you for your time and attention. I hand you back to Dr. Delano.
Thank you, Sinead, for sharing your perspective as a student and a demonstrator in the discipline of clinical anatomy. Now we're going to have Mr. Mbogazi coming with his presentation, which will cover health and safety protocols and procedure. Mr. Mbogazi is a senior technician in the discipline of clinical anatomy. He is responsible for administration of the body donor program. Mr. Mbogazi, I send it over to you. Thank you.
Thank you very much, Dr. Tikama. Greetings to everyone. My name is Mbogazi. I'm a senior technician in the discipline of clinical anatomy. So I'll be talking more about health and safety protocols and procedures. Body donation. So in the discipline of clinical anatomy, as we've been speaking about it, we have the body donor program. And also in the discipline, we have anatomy academics and anatomy technical staff. And some of the responsibilities of a technical staff, which I'm part of, is administration and coordination of the body donor program, putting up health and safety measures regarding body donation, preservation of bodies and protected specimens, updating of standard operating procedures regarding body donation, and ensuring that cadavers are always maintained in optimal conditions and conducted for teaching and for research. So the university is grateful for all the donors, firstly for registration to be body donors, and also be part of the body donor program community, which is critical for our purposes. acceptance of body donation. So the law that governs body donation in South Africa is the National Health Act. However, the university reserves the right to either accept or decline a body donation. Earlier, Dr. Tigama touched on the criteria that our university uses in terms of determining which bodies will be suitable for our purposes and which bodies will not be suitable. So the first three reasons which are highlighted under exclusion criteria, those cases will be bodies which, because normally we use the arterial system to preserve bodies. So in each of those cases when postmortem has been done, or a person that occurred during or immediately after a major surgery, or they've been involved in a car accident, the cases there, normally the arterial system will be either be damaged or not be intact, would not be helpful for us to preserve the body. The reason number 4 is people who reside outside of our province in KwaZulu-Natal. Reason why we don't accept people from other provinces is mainly because of high transportation fees. And reason for not accepting bodies for people who died because of suicide or there's any criminal cause of death is because we require to preserve the body as soon as possible, and we need to retain the body for a specific time period. So if there's any legal cases that are pending, it will interfere with our purposes. Lastly, the cases where a person will die because of smallpox, anthrax, viral hemorrhage fever, or COVID-19. In all of those cases, we don't accept because of the health and safety measures that we have put in place. So for COVID-19, as it is part of the bodies that we don't accept, for all the bodies that we accept in the department, they have to be tested for COVID-19. And then if the result comes back from the lab that they're positive, we immediately contact the family and inform them so that they can make funeral arrangements. We work very closely with funeral service providers. This is mainly because the university doesn't have the resources or the facilities, mainly transporting of bodies. So funeral undertakers, they are responsible for removal, for collection, and for storage of bodies of the deceased until COVID-19 tests are conducted and sent to the lab. So COVID-19 tests may be conducted by a medical practitioner, or between myself and Mr. Gwambe will go to the mortuary and take the samples and get them to the lab for testing for COVID-19. So the university shares its information, its standard operating procedures with the funeral service provider so that they are aware of our health and safety measures that they have to comply with when they are carrying out the services that the university pays them for. So the funeral service member staff need to wear appropriate PPE, and they have to always apply appropriate standard precautions whenever they are transporting our bodies. They also have to make sure that whenever they are doing removals or collection of bodies, they use a sealed body bag. And also the outside surface of that body bag needs to be checked for any leaks and be disinfected. And for any suspected cases of COVID-19, they usually use double body bags. The funeral service provider also assists us in acquiring relevant donation or state document that will be needed to processing of donation cases. And this is kept by both the funeral undertaker and the university. The equipment that is used when transporting of bodies, either COVID-19 or negative or positive, they are all the equipment that is used there needs to be disinfected. Handling of COVID-19 cases. So as I said, COVID-19 cases, we do not accept at the university for but it's very important to know that there is legal information regarding the transmission of the virus from a deceased person who has been confirmed to have COVID-19. And there's obviously some suggestion that there is a low risk potential in terms of transmission. And there's also been some suggestion regarding the efficacy of the embalming fluid, especially formalin and ethanol, which have shown some efficient against the virus. But we're still unsure, and in terms of how we should be handling donated, especially confirmed and suspected COVID-19 cases. So that's why we don't accept those body donations. We do observe some guidelines which are being developed and being followed in many parts of the world with regarding handling of COVID-19 positive cases. We're also observing some misinformation regarding disposal of remains of confirmed COVID-19 cases. It's very important to state that regarding COVID-19 confirmed cases, the decision to either bury or the body to be either buried or cremated lies solely on that individual or in that or on their family. We also have some standard precautions that students need to hire to in the department. That starts firstly even before the students start with their programs. The students are given a lab health and safety guidelines, and they have to sign indemnity forms for them to start using our labs. Also, students are given instructions on cadaver care. And during dissection, students are supervised and follow a specific dissection schedule. Some of the standard precautions that are practiced during dissection or during practical sessions. There is a restriction there's a restriction in terms of the number of students that are allowed per session. And also, students have to maintain a specific physical distancing while they're busy in our labs. They are also sanitizer dispensers that have been put in place in our labs, and during or in between sessions, door handles and surfaces in the labs are also disinfected with bleach. Students are required to wear appropriate PPE, which include mask, face shield, lab coat, and disposable gloves and closed shoes whenever they're in a dissection hall. As I said, for all bodies that we receive, COVID-19 test is conducted. Only when the tests come back negative, we are able to accept and embalm those bodies which are COVID-19 negative. So in our department, we have trained staff, technical staff, which are trained in human preservation techniques. And there's also a restriction in the number of people that are allowed in the embalming room to do embalming. Staff are also required to wear appropriate PPE, which includes disposable gowns, disposable aprons, latex glove, masks. They normally use heavy duty masks whenever they are embalming, gumboots, closed shoes, and face shields. All the equipment that is used during embalming and including instruments that are used, they are disinfectant every time after each session, after each embalming each case. And all the PPE, the disposable PPE that has been used during each case is disposed in appropriate medical waste boxes. Both our staff and students are required to get vaccinated only for hepatitis B for now. And all accidents that either occur during embalming or during dissections are recorded. We still need some more evidence. We still need some more information regarding how we need to handle COVID-19 positive cases, even before we even think of accepting them. So we still need more information regarding COVID-19 positive cadavers. The World Health Organization is not recommending embalming positive COVID-19 positive cases. That is obviously to avoid the excessive manipulation of the body. And in closing, it is very important for us that our staff that interact with the body, obviously we only accept a negative COVID-19 cases, but it is also important to state that it's very important that they have to maintain or apply appropriate standard precautions whenever they are interacting or in contact with the bodies. That includes hand hygiene before or after interacting with the body, disinfecting the work environment, which include the equipment and the door handles and all the equipment that they use or that is used in the labs, and also wearing appropriate PPE to the level that they are interacting with the body. I thank you.
Thank you so much, Mr. Kalumusa, for your presentation and going into the thorough detail about the measures that we've put in place in the era of COVID-19 and the discipline and how we handle the bodies. We're grateful to have, we have colleagues that assist us greatly with also the lab that we have in the school that assists with the testing of the donated bodies as well, so that we ensure that we do not receive any COVID-19 positive bodies. Thank you so much for that. We have a little bit of time for questions and answers, and all the panelists are now available to answer any questions. I do not see any questions in the Q&A box. We had one in the chat box, which we addressed earlier, and thank you to James Kui, who shared the color version of the global map of where we stand as far as body donation in the different countries, who is from the UK. Thank you so much for sharing that. Now we are open for questions. Colleagues, please, if you'd like to just ask a question live, I'm going to give you an opportunity to do so. Please raise your hand and then I will allow you the opportunity to do so. Thank you. It looks like we were that clear. Or please raise your hand if you have a question and I will give an opportunity to do so. I'm just going to share my screen to share this colored version of the global map of where we stand as far as body donation currently. But I am keeping an eye on the participants as well. So if there's anyone who would like to, it does not look like it. I think, let me see my chat box. Okay, thank you, Prof. Francois. Prof. Francois is the president of the Anatomical Society of Southern Africa. Thank you so much, and is a colleague based at University of Pretoria. Thank you so much. He says, thank you to the presenters. Have a lovely weekend, everybody. Thank you so much, Prof. Albert, for joining. Thank you for all the thank yous that I see on the chat box. I'm looking out for questions, and thank you again. I think I can do my closing remarks if it's okay. Colleagues and attendees, we hope you found the session informative and you learned something new for those who didn't know something new, about body donation previously. And I just want to emphasize the importance really of informed consent. And that's why we emphasize the importance of those who are considering body donation to be informed, because informed consent is one of the bioethical principles that we truly uphold together with autonomy, non-maleficence, and beneficence. And informed consent is very important. The person has to agree to the donation of their body, because if there's no agreement, then we are using that donated body outside of the ethical bounds that we are expected to uphold, and which we do uphold all the ethical principles. And I also want to just share my gratitude as well to all the communities who've permitted us to do the research that we've conducted under body donation as UKZN, throughout KZN, and also in the Limpopo province. We've had a study happen there. I just want to express that gratitude as well as we end. I hope we've informed everyone adequately, and please spread the word. You now know more about body donation, especially at UKZN. Please also spread the word. The more people that know about it, the better, and they can find an institution next to their own province. Body donation we need for the training, as everyone has alluded, and we also need it for research. Right now, we are continuously exploring diverse ways as the anatomy discipline to do research, because we've experienced cadaver shortages and it has affected research and postgraduate training as well, together with undergrad training. With those words, colleagues, thank you so much for joining us and sharing this time with us and spending it with us. We appreciate you joining us, and thank you to my panelists for a great job done. Thank you for those who are behind the scenes, Ms. Sosibo and Mr. Kurt, who has assisted us in this webinar. Take care, everyone, and stay safe and in this